we're about to go. And here we are. Hello, Galaxy, and welcome to our live stream. And thank you for joining us. I'm Lilia of Facialteam, and I use feminine pronouns, she and hers, which brings me to an important point. We do hope that this platform serves the community and gives voice to your concerns. So please do ask questions in the chat here on YouTube, and I will incorporate them into our conversation. Now, although these lives feature speakers of diverse gender identities in the past, it's not always the case. So I want to recognize again how crucial it is for trans and non-binary voices to not just be included, but also to have equal opportunities to lead all the TGNB related conversations. So please let me know if you want. And it brings me to what we're going to talk about today, which is how Facialteam's teamwork works, the well-being of FFS patients, and if we have time, we're also going to talk about, I'm sure we will, going to talk about FOREContour. So here to give expert opinions, we have one of our best, Dr. Javier Gutierrez, a Facialteam and director of Facialteam. Welcome, Dr. Gutierrez.
Thank you very much, Lilia.
Do we have a little delay? You hearing me okay?
No, you were about to be frozen for 1 sec, but I think it's working right now. Do you hear me well?
Yes, it broke up a little bit, but I can hear you fine. And according to YouTube, I have an excellent connection, so should be okay. Please, any of our listeners, do let us know if there's any terrible technical problems in understanding and hearing us today. So I'd also like to welcome Selina here, hailing from Japan today, a Facialteam patient. Thank you for coming.
I'm coming to Facialteam in just a week, exactly a week.
Wow.
So
very soon.
Excited, nervous, terrified, thrilled, all these emotions. Thank you for having me today.
Well, it's our pleasure. And yeah, it's a unique opportunity also for us to be able to talk about, what it's like in these last few days before surgery and when you can't sleep, as I know you said, Selina, and, nerves are at the top before embarking on the trip. So we'll talk a little bit more about that in a bit. So let's jump into our first topic, which is how teamwork actually works in Facialteam. So it's really great to have both of and perspective. So the benefits and disadvantages of teamwork, in your opinion, is particularly how it works here at Facialteam.
Yes, thank you, Lilia. When we mean wellness, we can refer to many aspects of the experience. But what I guess is the most important thing is about this is going to be not only a surgery, it's going to be a lifetime experience. So we should cover like 360 degrees approach. And it's not only about the surgical procedure itself, which is the most important thing, but also what is on before and after the procedure. So this wellness approach is accompanied by the coordinator labor, which we consider like a key activity within our practice. Without the coordinators, we couldn't be doing what we can do. They offer these like very close support to the patient. They feel like even they are like thousands of kilometers away from Spain, they may feel at home because they get a very close relation with the patient even before they have met each other in person. So from this coordination, also we also offer what is like more typical regarding wellness, no, like this all post-operative therapies that may make your post-op easier, like lymphatic drainage massage, the acupuncture, cooling mask over the face to diminish the inflammation. Also, a thing that is not very physical, but is very emotional, that's also means health, is about the psychological support that we offer. And well, we talked yesterday about these groupal sessions that all our patients may benefit when they come. And yeah, it's very surprising for us how they establish strong relationships once they're in Spain that last forever, and they become friends even forever. So this whole approach, of course, is very positive. It's a huge benefit from the patient. It's not only physical, it's only psychical. Yeah, I think this is very good for our patients. Do you want to talk about benefits, all the benefits and all the disadvantages, which I can talk about?
Sure. Yeah, but I'd also like to ask Selina if she wants to contribute on this topic about how teamwork was an element that was interesting for her when she was considering facial feminization.
Yeah, actually, that's something that I really noticed with Facialteam that made it stand out from a lot of other facial feminization surgery services or clinics. Unlike a lot of them, it's not tied to one specific name or one specific surgeon, where that is the only name that gets recognition. And then all the other people involved, you have no idea who they are. And also you don't know how involved the surgeon will be in your procedure. But also I was thinking about this a little bit more today. And I think one of the great advantages of Facialteam is that because you work so well as a team and everybody is an expert, the results are really consistent. There isn't really a style to, like, if you look at someone's face, former patient, you wouldn't say, oh, they look like they've had, a Facialteam face or whatever. Whereas some surgeons, they kind of go for a specific aesthetic rather than just pure feminization. And that face almost becomes that surgeon's face as much as it is the patient's face. Whereas with Facialteam, regardless of how many different surgeons are involved in the surgery and who they are, because obviously there are quite a few, it's quite a significant number of surgeons on the team, the results will always be consistent. The quality will always be high and predictable. And that's something that makes me feel really comfortable and sort of confident that, oh, I'm going to get results that are predictable and that are going to be consistent with other patients. So yeah, I think that, but also the teamwork isn't just the surgeons. There's teamwork throughout Facialteam's organization. And I've noticed that, especially with the patient coordinators. There are different patient coordinators for each stage. So I had one before in my initial sort of discussions with Facialteam. And then once my surgery was confirmed, I had a different patient coordinator. And at first, I remember being a little nervous. I was like, oh, but, this one patient coordinator, I liked her so much. And she was, really great. But then it was such a seamless transition. Everybody communicates really well. Everybody knows exactly what they're doing, and everybody is an expert in what they're doing. You don't have one person doing 50 million different things and dealing with thousands of patients or whatever. So yeah, I think that's, I think teamwork really is a key element of Facialteam, as the name would suggest. And yeah, it's just amazing how well you all work together. So yeah, I've been really impressed, and I think it's been nothing but positives for me.
Thank you, Selina. Fantastic. Glad to hear that. And Dr. Gutierrez, did you want to add anything in terms of any perceived disadvantages that there may be to how the surgeons in particular work together in your...
Yeah, from a surgical point of view, it's true that I consider it has tons of advantages against the few disadvantages that we could find. As Selina has mentioned, working as a team and being a team, a real team, is not only about the name, it's reality. So every one of us, not only the surgeons, but every one of us is specialized in some field, which is what we talked about before, about the consistency of the results, because as an expert in that field, if you repeat this, adapting, of course, to every patient, every single patient is different, the anatomy is different. But if you repeat this every single day with a big volume that we are managing every week, you become an expert, and you are trying always to evolve in that field. If you want to completely get everything done by the same person, first, it's exhausting, so this is going to bring errors. And also, I think this is a way that it may last a few months, but you cannot survive to that rhythm for your whole life. And yeah, so yeah, the expertise, the consistency, and even the efficiency. When you divide and split procedures, you just go for your procedure, you do it perfect, and then it's going to come another surgeon and is going to do his work in a perfect way. So I think this bringing a lot of efficiency to the surgical issue. And of course, for me, which is the most important thing, is about the global view with all the surgeons may have about a single case. We face a patient, we expose all the issues that the patient talk to us, to one of us. Normally, the first time we meet each other is by video call or even a personal consultation. Normally, you can have like 1 or 2 or 3 consultations before deciding the surgery, but then it's going to be evaluated by the whole team, and every one of the procedures and surgeons involved in that is going to be discussed all together, which is going to bring more light to the case. It's going to bring new ideas that one may forgive or forget about what to do. And it's always better to have a team doing the diagnosis, the planning, the treatment plan. So that's why it's so important to share these groupal sessions that all the surgeons have for every patient. In terms of disadvantages, I could say first is ego. Okay, if you have an ego, you cannot belong to Facialteam. This is not a team of egos. Okay, everyone here is the same. We're equals, and every one of us is so important for the rest and for the machine to work. From the coordinator to the person in marketing to the post-op therapist, whoever, even the hotel, the taxi drivers, everyone. So yeah, if you are a surgeon with an ego, you cannot do this. And this is very typical in surgery. Okay, money is never, that's a joke. And then time. For me, the big disadvantage, which is not disadvantage, is an investment on every single patient, is the time you have to spend for every patient. Because when we end our career in the university or even the residency, you are used to decide and take the decisions just by your own. And you do it like in a rush. So you don't spend the time enough that which is necessary to make things happen in the optimum way. Now it requires to us to work a lot, but it's a disadvantage. Yes, for me, on the other hand, it's a big advantage because we are investing this time on our patient's result, for example, and a happy patient is a happy facial team.
Thank you for that, Doc.
Yeah, I was gonna ask, add like one last disadvantage is as a surgeon, we are very focused on what we do. So we are doing this all the time. You can look at it and see, okay, you are a perfectionist, you are going 100% for this, and this is good. On the other hand, if you love the things that you do, maybe your field of work is going to be very reduced to that. And that may be a disadvantage for the surgeon, but that's all. It's not a big disadvantage. For me, it's magnifique.
They don't sound like real disadvantages overall, actually.
I don't see a disadvantage working as a team. For me, is the best thing I have ever done in my life.
Well, that's good to know. Thank you for that, Dr. Gutierrez. So it sounds like teamwork, both within the OR amongst the surgeons and out of the OR amongst the rest of the staff, is actually an integral part of contributing to our patients' well-being and the companions as well. So, Selina, did you want to ask any more questions on that, on well-being?
On well-being, yeah. Well, not so much a question, but just in general, talking. Sorry, you're breaking up.
It's okay. Go on.
I mean, in terms of well-being beyond just the people I've interacted with, I'm really excited actually about the recovery process at La Villa Marbella, because I'll be staying there. And I think the reason really isn't just that it looks great and looks really luxurious and comfortable and all that. Although, I mean, it does look beautiful. I'm excited to be surrounded by other patients who know what it's like to go through this experience. And I think that's the most important part of it for me is this isn't my first surgery and it's my first FFS, but hopefully the last. But the support network of having people who are trans like me, who are undergoing, similar procedures as me, who understand the process and understand the experience of just being trans, let alone being a patient there, is essential to having a good recovery, I think. Because if you're miserable, you're certainly not going to have a happy recovery. And a lot of people, I mean, I've never had surgery and not felt miserable afterwards, because it's a scientific fact that surgery can make you feel miserable just because of the anesthesia and everything. But who's around you at that time, especially if you don't have any loved ones visiting and staying with you, can really turn the experience around, where in the past, I've gone from having a completely miserable experience to feeling like I was at summer camp and just making lifelong friends. So I'm excited about that aspect. I mean, who knows? I can't, maybe we won't get along, but hopefully we will. So I'm excited to meet everybody there and meet the other patients.
I'm sure you will. And we keep hearing, from patients how great it is to have the Facialteam house at La Villa, and how groups form and they're able to create bonds. And it's so nice to see people at different stages of the FFS journey, just arriving as well, others who have just come out of surgery, and others who are getting ready to go back home. So I think it's definitely helpful for patients who stay there, apart from the fact that they get a lot of perks when they stay at La Villa, that are aimed at contributing to their well-being and their patients' well-being, like the nursing visits and lymphatic drainage massage, and the sessions, the group sessions with our psychologists 3 times a week. So yeah, there's some extra things like continental breakfast, room service, and laundry that are available to patients who stay elsewhere, unfortunately. So, yeah, that's great. Thank you, Selina, for those observations. Say something else. I didn't.
Sorry, you were breaking up, but well, the other thing I wanted to add is that obviously I know that the recovery is going to be hard, no matter what. It's traumatic surgery. It's never going to be, like lying in a bed of roses and just having a fun holiday. But what I feel at least from what I've seen, we'll see what my experience is actually like once I'm there and I've had the surgery. But I feel like Facialteam has taken a lot of effort into minimizing any discomfort and optimizing the recovery process as much as possible. So that makes me feel good, that I'll be as comfortable as I possibly can be after having this kind of surgery. I'll be as well looked after as I possibly can be. And that's really important, because that makes you feel like I don't have to worry so much about those things. And I'm worried. I'm super stressed right now. It's a huge undertaking. It is a life-changing experience. And yeah, it's also a long trip.
Yes, and also Selina, I think that's one of our big messages when we are talking to overseas patients, that we understand that it's a very traumatic moment in their life to go to a foreign country for surgery. So just from the beginning, our goal was, okay, she's coming here, she's trusting on us for her surgery. Okay, let's make her stay in Spain as she is at home, but in the best way possible. Even if you were from Marbella and you were staying in your house for the post-op, you wouldn't be better than what we are offering to you. Okay, and that's one of our goals. Okay, you shouldn't be worried about any other thing than recovery. Okay, you just come for the surgery, but you are going to be picked up at the airport by our taxi driver, who is he understands you perfectly, what you are going to do. You are coming for surgery, so he's very sensitive with that. He's going to take you to the hotel. Everything is going to be organized. Your agenda is going to be perfectly organized, so that you don't have to worry about what should I do now, where can I get a taxi, where can I eat, or things like that. We try to make things easier. We know there could be some fails, or because no one is perfect, but we can try to be as close as possible to you in order to offer like a global service and make things easier in such an important moment in your life.
Yeah, and I mean, I got my welcome kit several weeks ago, and it's gotten the schedule down to the minute for pretty much my entire stay. I mean, obviously there's going to be a lot of like free time, but you know, things like when I'm expected to arrive at the airport, which is great. Also knowing that, okay, they got this information, what time my pre-op consultation is the next day, what time the driver's picking me up to go to that pre-op consultation, you know, what time each appointment is, what time I'm expected to finish and go back to the hotel. All these little details are really good because then I'm like, I don't have to worry about it. And there's also contact information for my patient coordinator, both during work hours as well as out of work hours, so 24-hour coverage. All this information is great because then I feel, okay, I have peace of mind. I really don't need to think about anything. I just need to show up. And that's it. So as long as I make it to Malaga airport, everything else will be fine.
That's it.
So
Touch wood. Nothing happens on the way to the airport.
Yes, I'm sure it'll be a smooth flight. And so I just want to summarize up to this point. We've talked about how teamwork is an element that contributes. Now just spoken about well-being and some that we're able to help in terms of our services like lymphatic drainage, etc. Sorry if I'm breaking up. I saw a little message that my connection is unstable. So now I would like our technological aspects that are aimed at contributing to our patient wellness. And so that brings us to FOREContour. And so Dr. Gutierrez, can you start by telling us what is FOREContour? Did you want to share your screen right off?
Okay, I will do it right now. Okay, share my screen. There we go. So can you see the screen, the PowerPoint presentation? Okay, FOREContour
Yes.
It's the method that we have created a long time ago, where we can refer to the forehead area modification in terms of feminizing the aspect of our patients. Okay, it's not only about the forehead bone itself. We normally include the forehead area and also the hairline. Okay. So when we mean forehead, is much more than just the forehead bone. We're going to be modifying big and extensive area that includes all these color items that you see there. So it's a bony work that is going to have a very big impact on on facial gender recognition because of how our brain recognizes gender by looking at the eyes. It's not only about the bone work, as I told you, it's also about position of the eyebrows by brow lift and also the hairline redefinition. Okay, so we are going to include all of these aspects in the evaluation. And why is a method? Because it's not only a surgery, it's a method that is based on scientific results that are there for more than 10 years of experience with hundreds, thousands of patients operated under these techniques that have been evolving during the last years. And this is based on these publications in very prestigious journals of surgery. And of course, it's based mainly on technologies. Technologies include the piezo surgery, which is the tool that only cuts mineralized structures such as the bone, so it cannot harm other tissues that are surrounding the area where we approach. It's also about the 3D planning in the computer, which is very important to see an anatomical structure that is over this area, which is the frontal sinus. I can tell that I don't know if our audience is very used to medical terms, but I guess for patients who are interested in surgery, it's important to ask questions to their surgeons about what type of reconstruction they are predicting or to use during the surgery. We can tell type 3 is our 95% of the reconstructions for every single patient. Is the only reconstruction that allow us to get to the level that we need in order to create a proper setback, in order to create the optimal outcome that the patient is expecting. Okay. So we consider also 3D planning is very, very important to demarcate the anatomical landmarks that we are going to approach. Okay. This is very, as we were discussing yesterday, is very important and it's very visual. You can imagine this on the lower jaw guides that we use with jaw contour, but the FOREContour, it's also important because the anatomy varies from patient to patient, and we have to foresee what is going to happen in the OR. Okay, and it is not only about the surgery itself. Okay, we can talk about many things, but I think this is not the topic today. We will talk in detail about FOREContour in the next series of lives.
Thank you, Dr. Gutierrez. And yes, we'll talk about the details of FOREContour in the future. So that was just a little taster. Selina, I know you have some questions though, so about FOREContour. So do you want to ask anything?
Yeah, I just wanted to know, like, what is the key difference between FOREContour and just, what is sort of traditionally known as type 3? Because I know type 3 is included, as you said, and is often the case. But how is FOREContour different than what you would be getting elsewhere?
Mm-hmm. Okay, so it's from the pre-op evaluation where we are going to use the 3D CT scans and a specific software to define the area that we are going to cut in the bone for the reconstruction. Okay, and also
so that's sinus plate?
Yes, we can print a 3D guide that is going to just settle where the osteotomy is going to be done. Okay, so we define that in the computer prior to surgery. But it's not only about the planification, which it is, it's also about the surgery itself. So our technique has evolved a lot since the beginning, where Dr. Capitan and Simon were doing the cases till right now. It's the core base is the same, but very tiny details that gives this extra difference has been improving our method. So, for example, from the approach, it's very typical in many surgeons to use always the pretracheal approach, which is the one that leaves a scar here. We only use a scar in this place. We set the scar here if hairline lowering, so we need to reduce this distance, because creating a scar in an exposed area is something which the patient shouldn't be condemned just by the surgeon, okay? Because the surgeon only knows how to do it by this approach, and this is not like that. So coronal, which is the one that hides the scar here, is our gold standard. But the coronal has also evolved, and it could be anterior, which is the one on top, but we can also go posterior, okay? At this same moment, as we're evaluating the hairline, if we need to correct the hairline, we can divide into several patterns of baldness or recession. Some of them can be corrected or improved during our surgery in the forehead. So we call this simultaneous hair transplantation. It's part of the method. Okay, so we're going to remove this strip. The incision that we use is different also. It's like a lazy line scar in a trichophytic way that allows the follicles to grow through after a few months. The way we approach this area, just assuring that this is very technical, I'm sorry, but a pericranial flap is conserved in order to assure that the survival of the bone is going to be assured. That's crucial for the surgery. Then the 3D planning, the osteotomy with the ultrasonic device, the use of endotines or resorbable devices that allow us to anchor the eyebrows if it's necessary in the position that we need.
Can I just ask one question, Dr. Gutierrez, about, you mentioned the PSO surgery, which is a very important aspect of FOREContour. How does this particular technology contribute to the well-being of our patients?
In one hand, it's going to be like less aggressive. So the cut in the past was performed by saws, okay, and with a small bursts. So it was very an uncontrolled maneuver.
Mechanical.
Yeah, very mechanical. Now this is the technology is by vibration. It's ultrasonic vibration, so it cuts only the tissue that it has calcium, which is mineralized, which means that it cannot harm like the nerve or even the eye, for example. Okay, with a saw, you always were on that risk that having like a bad maneuver during the OR and cutting something that you don't want it. And that's not happening anymore. Okay. Then also because of the type of cut that it does by vibrating, is much more respectful for the tissue, which means that the bone reacts against the aggression normally by getting the area with a lot of swelling. Okay, and this happens in a minor way with the cuts that are performed with the PSO surgery, and that's the main reason for the post-op to have improved. Wow, Lilia is out. So
yeah, but please continue. I guess we'll wait for Lilia to join us again.
Yeah, I think we're live either.
I don't know. Because we can't, if people can see us now, we can't see Lilia is in charge of the live feed, and she can see the chat, but we can't. So, so we don't know what's going on here.
Anyway, yes, to answer that question is mainly it's about the swelling and it's about the control that we have in order to respect the vital structures that we are very close to, but we are far away from.
And you use the ultrasonic technology for the jaw contour as well.
Yes,
right?
And also for the rhinoplasty.
Okay. Wow.
Every procedure that involves the bone is cut by or even scalped. We can scalp with the PSO technology.
Wow.
Which is very interesting. It has changed our lives. So we have been using this for more than 6 years, 7 years, I guess. And the results are like day and night.
How's the patient recovery, like by comparison? Like, have you noticed significant reduction in like swelling and like recovery
on average
times?
Yeah, on average is like that. Patients get less swollen, much less swollen. Of course, we have patients that we have used the PSO, they get like a balloon. Okay, they got very swollen, but that's also the way a patient gets swollen is because of many factors. Okay, so there are many reasons. One of the most important is the technique that you use, that you are being very delicate with the soft tissues, the approaches in the layers that you have to do, you are respecting the lymphatic drainages, you are using the proper appropriate technologies. So that's important, but also it's on patient side about the type of skin. For example, patients with a big elasticity on their skin, with this pale skin such as me, which I am very elastic, we normally get very swollen, very, very swollen, and we get rid of the swelling in a quick way. Other very thick skins with non-elastic skins, normally it's like when you try to inflate a balloon, no? If it's very tight or if it's like very elastic, no, it's like that. Normally they get less swollen, but they recover slowly. It's more or less like that.
I guess that makes sense.
And what we have been talking about, the post-op recovery from an FFS, nowadays is not about pain. Pain is very easy to control with very basic medication. We normally provide paracetamol and ibuprofen, which is like the minor. Of course, we can offer you plenty of medication in case you need it.
Oh, it's fine. I don't like taking pain medication at all. Especially strong pain medication. I really hate taking it. So I prefer pain to the sort of discomfort of like side effects. Because I get really bad nausea.
Yeah, that's one of the disadvantages. But normally it's not necessary with all these physical therapies that we provide, and also the cooling mask. Everything is about the swelling and how to manage the swelling and how uncomfortable that could be for you. And in the end, what worries the patient once they come to the checkup is about their aspect. So it's not been as hard as they expected because they are worried about the aspect and not about the pain. Or it's more or less like this.
Yeah, see, I'm not worried about the pain. I'm just worried about like the discomfort more than the pain. Every time I've had surgery, the pain obviously bothers me, but like not being able to sleep, that's always a problem. Nausea, that's always a problem, like all those things. But it's good to hear, because it sounds like, I think a lot of people, when I tell them, oh, I'm going to have FFS, and I explain to them what it involves, they think it sounds like this really scary thing and it's going to be extremely painful. And I tell them, I don't think so.
You will let them know once you have been operated. Yeah, I was right. It's not about this pain. I hope.
I hope so too. I mean, touch wood, but yeah, it's exciting. Oh my gosh. I can't believe it's happening so soon.
Yeah.
A year ago, I didn't even think, I thought, this would happen in like
the future, 5
years, maybe, if I'm lucky. So I'm just so excited and happy and a little bit scared.
But that's pretty normal, I guess. It wouldn't be normal if you were not worried about the surgery or.
I think the most scary part, I think the thing that gives me the most anxiety is worried that something will go wrong that will prevent me from having the surgery. Like getting COVID, or maybe there's some, abnormal CT scan result.
Problem. I don't think so. Normally there are no surprises. We have only canceled like 3 or 4 surgeries since COVID began, which is nothing. And as everything is very well controlled nowadays, the worst scenario should be, okay, if you are test positive, once you're in Spain, we're going to make everything possible to operate you as soon as possible in this trip. So that shouldn't be
a to know.
Big concern. Okay. Another,
because I was a little worried that, if I get there, because like, say, for example, I catch, because right now I'm taking every precaution. I'm not going anywhere. I'm not talking to anybody. I wear a mask everywhere I go, constantly washing my hands. But because I have a 20 something hours of like traveling
Yeah, you never know.
internationally, I'm really worried that, sometime, at an airport or on the plane, I'm going to catch COVID. And then by the time, the day of my surgery comes, I'll be sick. And then, yeah, I was worried. Oh, and then that's it. It's finished. I just have to wait, however many more months until I can do this again.
No, that's not going to happen. For sure.
That's good. That already is a huge relief. So that's good to know.
Great. At least, look, you have solved this important thing in this life.
I don't know if anybody is. I suspect probably we're not live because it's through Lilia that we're connected, right?
But yeah, I think it's being recorded, so they could there.
So she could upload it.
Yeah, maybe they could share this, so we could go on with all the things that we need to talk about. I think we have covered most of the things.
Yeah. I think FOREContour was the last topic to cover. Yeah, I'm excited because I didn't know about FOREContour until just recently. Because the video on the Facialteam channel is still the old video for forehead reconstruction. So I just assumed that would be what I was getting. And I think Dr. Capitan kind of explained to me the process, but there's a lot of information for me to absorb. So I think some of it, I just watched the video and I was like, okay, that's how it's going to go. Oh, I did have one question. We talked about this before, but maybe in case people are able to watch this, what are the are there any disadvantages to the posterior approach?
The main disadvantage, I think, is just about the location, because when you are the first couple of nights, when you are laying down, leaning your head against the pillow, maybe a little more discomfort. You can feel that a little more pain because of leaning against the wound, because it's where you are laying down. We provide like specific pillows, like these travel pillows that has like a hole in the middle to relieve. Normally it's not enough, but I could say this is the worst disadvantage. Another disadvantage is the circumference of your head at the back is shorter than on here. Okay, so for the strip, if you need like a big amount of follicles, we need to do like a very exaggerated lazy lines to get like more length for the strip. But for us, it takes like 10 more minutes to do the surgery by the posterior approach, and the aesthetic result of the scar is always better here because it's always covered by the hair.
Yeah.
Here on top, if you have like a mild alopecia or some area of recession, it could be possible to be visible in the future, and that's why most of our times are chosen to place the incision here.
Yeah, because I don't know what approach the surgeon will take for the incision for me, but I imagine it will probably be the posterior approach because my hair, because I'm also getting the simultaneous hair transplant, the hair quality at the back is a lot better than at the top of my head, as you can see.
During the pre-op evaluation, our hair surgeon will take a look to all the hair quality, the density. They will measure that, and they are going to point us where to do the incision. They are going to tell us, okay, do it here. Okay, so we will take the strip from that area in order to get the maximum amount of follicles with the biggest density and also the quality.
That's amazing. Yeah, that's it. It's so good that like you work together on that, like choosing that. And I don't know. I like the idea of the simultaneous hair transplant because it's not wasting anything.
Yeah, that's it. Yeah.
Yeah, it's a really efficient way of doing it. Because I knew I would need a hair transplant. I didn't want to get the hairline incision for hairline lowering because I don't like the way it looks sometimes. I'm very scared of like scarring. So I always wanted to get a hair transplant here anyway. And so the idea that both can be done at the same time is just, it's great. The only thing is the recovery sounds like a pain, but I think that would be the case no matter what. So
yeah, but it's only the first week. The transplant is a little annoying by this first week that you have to be taking care of feeding the hairs by spraying every hour. That's the most.
Do I have to do that
thing.
even like 24 hours a day, or can I stop when I'm sleeping?
You can stop when you are sleeping. Normally the nurses in the hospital can do it for you, and during the night we are a little more flexible. You can do once you are away from hospital, you are discharged and you are at the hotel, there is no nurse at night, so you have to do it, but every 2 hours more or less. So it's just one spray and you keep sleeping. But it's just for the first week, which is crucial for the survival rate of the follicles. Once the first week is over, this behaves as your own hair. You can't even touch it. It's not a problem.
That's good. And then I know this is a little less your field because I already spoke to the hair transplant specialist. But how soon do the transplanted hairs fall out? Because I know that you get the transplanted hairs and then it has to heal and then they fall out and then it takes several months before they start growing again.
It may happen at any time. It depends on the cycle where all the follicles are. But normally the rule is around the 3rd, 4th month, they may fall. Normally it's by then. Okay.
That's good to know.
You get like a red area, only you don't see the hair. You get into panic and you call the post-op coordinator and tell, oh my God, all my hairs have fallen. What should I do? And it's just a matter of being patient, which we know is quite difficult.
I know that's such a big part of it, right? Just having to wait and just trust the process and the recovery, knowing that, just with FFS in general, the final results won't come until, possibly a year after the surgery, right?
Yeah.
But you didn't see immediate results as well. They're just not the final results.
Yeah, we see the immediate results. By the first week, your aspect is not ideal. Okay, but after 3, 4, 6 weeks, more or less, your aspect becomes pretty normal. Okay, no one will perceive your aspect as something weird. You look, oh my God, look at that woman. She had her eyes completely black, or she's so swollen that looks like an alien. It's not like that. So you are going to do even social life from the very beginning. This first, 2nd month, your aspect is normal. Of course, it's not the final result. Normally, this is very visible.
Well, I'm not getting a rhinoplasty.
Okay, perfect. Yeah. So forehead, normally the almost definitive result normally arises around the 6th, 8th month. It's not the final, but it's very close to that, because of the swelling goes down and it disappears quickly. For example, the nose and the chin are the areas that take most time to heal. And always say the nose takes 1.5 years. For the chin is 1 year, more or less.
Yeah.
But we're talking about very subtle differences.
Yeah.
In comparison with the 1st month, 2nd month.
Right. That's good to know. it's good to sort of manage expectations, because that's a huge part of like any surgery. I find is just sometimes like you panic after a few days thinking, oh, this isn't the result I was expecting.
Yeah. And
But then if you know, okay, it will take a while.
This is very typical around the first, second month, because you don't remember surgery and the post-op because you feel strong enough, completely recovered. And then it's when you start thinking, okay, this is going to be my face for the future. And it's not like that.
That's good to know. Well, I guess you have appointments to get to.
Yeah, I have to, I'm afraid I have to quit because I have a few appointments right now. It's been great talking to you.
Yeah, you too. I mean, I don't know if this will end up being seen by anybody, but it was great for me to be able to ask you all these questions. So, and if people will see this, thank you all for watching us and joining us. And we're sorry we couldn't look at your questions or anything.
But we can do that in the future if they want.
Yeah, I'll be happy to come back. All right, well, have a really good day, and I'll see you hopefully when I'm in Marbella.
Yes, sure. Thank you very much, and enjoy your day. Bye, Selina.
Thank you. Bye.
Good night.
Bye.